When a nasal cannula or face mask is prescribed for a patient, begin by checking the details of the healthcare provider's orders. Verify the oxygen delivery method, flow rate, and duration of therapy. Perform hand hygiene. Ensure privacy and introduce yourself to the patient.
Good morning. My name is Cindy, and I'm going to be your nurse today.
Then identify her using 2 identifiers.
Tell me your first and last name and your birthday.
Beverly Hampton, and my birthday, January 8, 1948.
Okay. I'm going to be checking your vitals because we have an order for some oxygen. So this is a pulse oximeter, and it's going to check your oxygen saturation. Then I'm going to listen to your lungs.
Before administering the oxygen, assess the patient's respiratory system, including respiratory rate, sputum production, and lung sounds. Also, check oxygen saturation, or ABGs, if those values are available.
Take some deep breaths for me.
Then attach the oxygen delivery device, that is, the cannula or mask, to the oxygen. If the ordered flow rate is greater than 4 liters per minute, be sure humidification is attached. To position a nasal cannula, place the tips in the patient's nares and adjust the elastic headband or plastic slide so that it fits comfortably and snugly. Leave some slack on the oxygen tubing to keep it from pulling out as the patient moves. Secure the tubing to the patient's gown if necessary.
Okay, Mrs. Hampton, I noticed that you're a little more short of breath. We're going to give you a little higher flow in oxygen here to help you out.
A reservoir nasal cannula or oximeter is applied in a similar manner, but with the reservoir positioned beneath her nose or hanging like a pendant.
Does it feel okay?
I think so.
A Venturi mask is applied over the mouth and nose to form a tight seal.
Does that feel okay?
Yeah.
I'm going to hook you up to some more oxygen. It should help you to breathe a little easier.
A non-rebreathing mask is equipped with valves that prevent exhaled air from entering the reservoir. Once the oxygen has been turned on, the bag will remain inflated. Confirm that oxygen is flowing, and then place the mask over the patient's mouth and
Put
nose.
this around your head.
Note that a partial rebreather has one of the valves removed. A face tent is positioned loosely under the patient's chin and over her mouth and nose. The tent delivers humidified oxygen at a flow rate of up to 12 liters per minute. Because a tent lacks the tight seal that a mask offers, however, much of the mist escapes into the environment. For all methods of oxygen delivery, confirm that the oxygen source and flow meter have been set up properly and calibrated to deliver oxygen at the prescribed rate. Ensure that the ball on the flow meter is even with the number of liters per minute ordered. After applying an oxygen delivery device, document your respiratory assessment and all actions related to oxygen administration, such as delivery device and flow rate. As part of your follow-up care, check the cannula or face mask every 8 hours and keep the humidification container filled with water. Monitor the patient's pulse oximetry and arterial blood gas levels, if needed.
Make sure your oxygen is going at 5, and it is. I'm going to check your pulse ox one more time to see what your oxygen saturation is.
Okay.
When you're finished, perform hand hygiene.